Thank you, Mr. Iwry. American Congress learned of this controversial decision via a obscure blog post on the eve of the 4th of July, July 2nd to be exact. This is a blockbuster decision. It wasn't made in just one afternoon. So when did the Treasury Department make the final decision that Obamacare was not ready for businesses?
Mr. Chairman, let me start by saying that my responsibilities relate to policy, health, tax policy.
Sure.
There are others who are responsible for communications, media relations, congressional relations, public affairs. So I'd be happy to put you in touch with the appropriate people on detailed questions of the mode of announcement and timing.
Let me just say, you're very well respected. In the policy area, you have a long, distinguished record. That's why we're very pleased you're here. The title of this is the hearing on the delay of the employer mandate. The timing is based on the policy, the decision that the policy would not be ready for businesses, and a postponement was appropriate. So this isn't a press issue. This isn't a communication issue. When did Treasury make the final policy decision that Obamacare would not be ready for individuals and must be postponed?
Mr. Chairman, Treasury made the decision that employers' requests for more time to comply with the reporting requirements were valid requests and meritorious shortly before this transition relief for employer reporting
so
was
sometime
announced.
In June?
The decision was made, I would say, yes, sometime in June, but it was considered over. It was considered over a very careful way.
For a while before that.
For a while,
yeah.
And it was very carefully thought through by a whole variety of
No,
offices.
we get that. So early June, mid-June, late June, just before the announcement?
I can't really be more specific. The decision was made in a very deliberate way.
Sure.
So it was obviously something that took into account an evolving body of evidence,
Sure.
requests from employers, input from those who do the reporting.
Sure. Once the Treasury Department made that decision in June, when did it inform the White House of that very important decision?
There was a continual process of consultation, as there typically is. This reflected the usual coordination between departments.
So you're saying you kept
Treasury.
the White House informed throughout the long, deliberate considerations?
The White House was certainly informed, and we coordinated on the analysis of whether this
Sure.
was an appropriate direction to go.
Couple thoughts. I have questions about this whole timeline. I think we all, the American public certainly does. So on June 7th, when the President proclaimed the law is working the way it's supposed to, had you already been in contact with the White House that you were considering delaying one of the twin pillars of his health care law?
Mr. Chairman, the marketplaces are on target to take enrollment 1/1/14 and to start their
Sure.
open enrollment period October 1, 2013.
But I was asking, I understand we've been following the timeline very carefully because so many deadlines have been missed. The question was, since you just testified, you've kept the White House informed throughout the whole deliberate process. Was the White House aware of your decision to postpone this, or the possibility when the President told the American public everything's great, it's working the way it's supposed to? I'm just trying to understand if there's a disconnect between Treasury and the White House in this area.
Mr. Chairman, the Treasury and the White House have been closely coordinating in this whole policy area, as have the other departments that are involved, HHS, Department of Labor.
Well, that's raised a great
and
question.
OMB.
When did you inform HHS and the Secretary of your decision that Obamacare would not be ready for our businesses?
The decision, Mr. Chairman, respectfully, was to give employers more time
For reporting and therefore
reporting.
postpone for 1 year. So when
Right.
did Treasury, and I know, again, we're thrilled you're here. You have a great reputation. We know you know this issue inside and out. There's no question about that. So, and because you know what the topic of the hearing is, so when did Treasury Department inform HHS?
Mr. Chairman, I have not been involved in all the conversations, all the meetings, or all the phases of the decision-making process.
And I don't really expect any human being to be able to be in all those meetings, but when was HHS informed?
I'd be happy to take that question back to people who have been
And respond.
involved.
Right.
And
Was any member of Congress or their staff informed of this decision ahead of the July 2nd blog post?
Again, Mr. Chairman, my role is not a congressional relations role, so I'm not able to give you a good answer to that question, a reliable
but
answer
you'll-
to that question
but
now,
you'll
but I
answer
would be
that by
more than
letter.
happy, yes, more than happy to take that back to.
Can I ask you this from policy standpoint? Clearly, the decision made Obamacare is not ready for businesses. As we sit here today, do you think the Affordable Care Act today is ready for implementation for workers and their families?
Definitely, Mr. Chairman. I think
It is
the
definitely
affordable,
ready today. The exchanges are set up. The
it is
process
on a
for
path today.
workers.
It's not supposed to be implemented, of
Okay.
course, today, but I take your question to be,
Is it ready
on a path?
today?
Is it on a path to be ready when it needs to be ready on January 1st, 2014?
The reason I ask this is
Yes.
that you probably believe Treasury has the legal authority to postpone the employer mandate, correct?
I'm confident we do.
And you have then the legal authority to postpone the individual mandate, correct? So if you can do one, obviously you can do both.
Mr. Chairman, the questions of legal authority are ones we take very seriously and deliberately. And
You obviously
we-
researched one on the employer mandate. In the individual mandate is its twin brother. So answer is, yeah, you probably believe you do.
We would not necessarily apply the same analysis to any other provision. The decision to provide transition relief, while one that, as you know, Treasury has taken on a variety of occasions with under different administrations.
You know, I think
different
what our big
legislation.
worry is
Sir.
that you have the legal authority in your mind to postpone this for businesses, for Warren Buffett. And you knew at the time that the individual mandate isn't ready either. It's not available for workers. So why did you make the decision that Warren Buffett gets relief from Obamacare, but Joe Sixpack doesn't? You know, why does an average worker have to comply with the law on time, on schedule, but the businesses who have lobbyists and the ability to talk directly to you in the White House, why did they get relief and why didn't average workers today get the same relief?
Mr. Chairman, we believe that workers today are getting a tremendous benefit from this law.
Well, you know, did you see the letter from labor? Do you think labor unions represent workers? Yes.
Of course, Mr. Chairman.
There you go. Not a leading question, just kind of obvious. So labor unions have come out, leaders have come out full force this week saying Obamacare will shatter their health care and undermine the backbone of middle-class Americans. A majority of Americans are saying to the White House, look, we're worried. We want this postponed for us as well. So is the White House listening to the voices of average workers or just listening to voices of business?
Mr. Chairman, the White House and the administration as a whole is certainly listening to the voices of average workers, and in fact, it's the average workers who are the driving motivation for this very critical health care reform that provides premium tax credit.
And they're asking to be treated as fairly as businesses are. Warren Buffett gets a break. Joe Sixpack doesn't. The single mom working at the restaurant doesn't. Final question. There's a lot of missed deadlines already. We expect there will be more. The Labor Day holidays coming up. Are there any Twitter accounts of interns at Treasury we should be monitoring over the Labor Day weekend for any more announcements on the Affordable Care Act?
Mr. Chairman, if I may, the tax benefits of this law for individuals are of historic proportion. The insurance market reforms, eliminating pre-existing condition exclusions, and so forth, are of historic significance. And so the focus really is on the American people.
And those provisions, by the way, I know you verify this, stay in place if the individual mandate is also postponed, correct?
It is problematic.
No, but the law stays in place because postponing the individual mandate has no impact on children age 26, any of the other provisions of the law.
Mr. Chairman, I think that health policy experts across the political spectrum have made clear that if you do not have individual responsibility, personal individual responsibility to maintain health coverage, that the key insurance market reforms that the American people deserve and are so eager to have will not be workable.
And health policy experts also say if you can't verify that your employer is offering affordable coverage, or government-approved coverage, that it is very difficult without major fraud possibilities to force workers to buy government-approved health care or pay a tax. Thank you, Mr. Iwry and Dr. McDermott.